At Black Health Legacy, we're trying to be one of the largest studies that thinks about inclusivity in what we do, working with Black communities. Today, we're here in Whitechapel having our community engagement and stakeholder launch. What we hope from today is to open the dialogue about hearing the real views from the community who will help us make this project a success. We've heard some fantastic speakers today that have really helped us to think about how we want to do the research and why we want to do the research.
As a diabetes doctor working in the NHS, I see the really stark inequalities experienced by people from diverse backgrounds living with type 2 diabetes. We see through our clinics and in our hospitals a large number of people from Black communities who have type 2 diabetes and who are experiencing the severe complications affecting their kidneys and their eyes, as well as leading to heart attacks and strokes. Now, research is bringing great advances in how we diagnose type 2 diabetes, how we decide who is at risk of it, and also how we treat it. The problem we have is that most of that research has been conducted in people from white European backgrounds.
Essentially, people from Black African and Black Caribbean backgrounds are largely underrepresented in genomic research. So that means prevention mechanisms, treatments and interventions may not work as well because Black people weren't in mind when a lot of these databases were being built. Therefore, Black Health Legacy aims to change that by including people of those backgrounds in genomic health research.
It's all about researching and collecting samples from people who look like me, people in our community, not just to help us now, but to help generations in the future.
We've had some great talks today. We've heard from Dr. Nandi, who is part of the Race Health Observatory. We've heard from Rufa J, and we also have some of our community stakeholders here today. Caribbean African Health Network, Black Research Health Network, and lots of community and engagement pioneers. What we want people to go away with today is knowing how they can become part of Black Health Legacy, how they can share the word, and how they can help us to keep improving the project to make sure that we are doing the research in an equitable and safe way for Black communities all over the UK.